everyone, greetings to all of you. I'm Shreya Varshini from the beautiful Spotless Skin team. I hope you're all doing really well and taking really good skin care of your skin. A very warm welcome to today's special Instagram live session. Today, we're talking about something super important, often overlooked: sunscreen filter awareness and acne management. Many people believe that sunscreen causes acne or clogs pores, but the truth is, choosing the right sunscreen is the key, especially for acne prone skin. Acne is not just a cosmetic concern, it affects millions of people physically, emotionally, and socially. But did you know what the right kind of sunscreen can worsen your acne while the right one can actually help, protect, and heal? That's why in today's session, we'll talk about how sunscreen filters work, which ones are safe for acne prone skin, and how to include them in your daily skincare routine. We're also covering important aspects of acne management, so it's going to be an insightful and helpful discussion. We are thrilled to have with us today Dr. Khyati Sidapara, a leading dermatologist from Rajkot. Welcome, ma'am. Dr. Khyati Sidapara is an MBS, MD Dermatology, Fellowship in Lasers, Aesthetics, and Dermatosurgery. She is currently practicing at Glovia Skin Clinic, Rajkot. Doctor, we are so happy to have you here today. Now let's begin.
Very good afternoon, and thank you for such a warm welcome.
Thank you so much, Doctor. Can you please head ahead with the questions?
Okay, so
Sure.
as you have discussed, everybody is using sunscreen here and there, but nobody is concerned with what the actually contents are present in the sunscreen and what are the ideal sunscreen filters which we should choose according to our skin type, especially the acne-prone skins and acne
Mm,
patients.
yeah.
So this session is specially for such patients who are having acne or having acne-prone skin, and they are
Mm,
concerned about the right choice for their sunscreen.
okay. Sure, Doctor. The first question we have today is, what is acne? And can you tell us the types of pimples that people get?
So acne is basically a disorder of sebaceous glands present in our skin. It can occur due to many factors like hormonal factors or overproduction of sebum, clogged pores, or due to many medications like topical application of steroids and oral medications like steroids and other immunosuppressive drugs. So
Okay.
acne are basically a disorder of pubertal age group, but it can occur in any age group due to hormonal imbalance or other pollutants and other environmental factors. So
Mm,
acne are basically of two kinds which can occur in patient which one the occurring during the pubertal age due to hormonal changes and another one is adult acne.
mm. Okay. The next question we have today is, if we get pimples on certain areas of the face, does it mean something is wrong inside our body?
Yes, sometimes there are a link between the site of pimple you are having on your face and some internal body imbalances. Like if you are having acne over the forehead area, then you must be having a seborrheic dermatitis or oily scalp. If you are having a cheek acne, they are mostly pubertal acne or hormonal acne, which can occur due to hormonal imbalance in your body. And if you are having an acne with overgrowth of fine or villous hairs over the face or thick hairs over your chin, it can be due to a PCOS or PCOD, which is common in teenage girls.
Okay, that's a really good answer, Doctor. Thank you. And what are the different levels or grades of acne that we have?
They are basically of four grades of acne. The first one is the starting of acne, like grade 1 acne will have mostly black and white comedones, which are basically a non-inflammatory lesions of acne. The grade
Okay.
2 acne patients will have mostly papular or small red elevated skin lesions. The third one is grade 3 acne, which will be mostly having a cyst or nodules. And the
Okay.
fourth grade is having abscesses, nodulocystic lesions, and mostly sinus tract formations and well developed scarring of healed acne.
Okay. And what are the treatments we'll have for all these mild, moderate, and severe acne, Doctor?
In the very first grade of acne, we can go with topical therapy with topical retinoids and topical antibiotics. We can do comedone extraction for the grade 1 acne, which will halt the progress of disease towards the next higher levels of grades of acne. In
Mhm.
grade 1, in grade 2 acne, we will have to go with oral as well as topical therapy. Oral therapy in the form of antibiotics or oral retinoids, and topical therapy in the form of topical antibiotics and topical retinoids. In grade
Okay.
3 acne, we can go with higher doses of antibiotics as well as oral isotretinoin, and topically, we can go with clindamycin, metronidazole, or other
Mm.
higher antibiotics. We can go
Okay.
with other procedures also like chemical peeling, which will decrease the overall oil secretion of the skin and which will prevent the post acne scarring and PIH. In grade 4
Okay.
acne also, we can go with oral and topical therapies.
Mhm. Okay, doctor. And are there any specific skin treatments or procedures for acne as such on the whole?
Yes, there are many options available which we can choose according to the grade of acne, the age of patient, and the requirement of patients. Like chemical peeling is there, microdermabrasion is there. In grade 1 acne, we can do comedone extraction and chemical peeling both. And in like larger lesions, we can go with intralesional corticosteroid injection to decrease the inflammation and size of the lesions. For scarring, we can go with CO2 laser ablation or PRP and many other procedures.
Okay. And what should people with sensitive skin do if they have an acne?
Sensitive skin patients are prone to develop acne-induced erythema and scarring. And if
Mhm.
we are prescribing them oral or topical retinoids, they are more prone to develop dryness of the skin and their skin can become photosensitive. So they should always use a suitable sunscreen for their skin.
Okay. And what is maintenance therapy in acne and why is it important for everyone?
Maintenance therapy is necessary to prevent the post-acne scarring and PIH.
Okay.
In maintenance, we can give topical therapy like anti-pigmenting agents like kojic acid, atropine, retinoids, and a good moisturizer to prevent the dryness of the skin which is induced by retinoids, and a good sunscreen to prevent us isotretinoin induced skin dryness and photosensitivity.
Mhm. And can food cause or increase the pimples that are occurring in our faces? And what foods should we specifically avoid to eat?
Yes, food have a very specific role in triggering the acne or aggravating the acne. Like we should avoid high glycemic food index
Mm.
foods like dairy products, milk products, high sugar level products, which can induce oiliness of the skin and which will eventually clog the pores and develop acne.
Okay. We have a question from Deepak Saxena, doctor. He says, I
Yes.
wash my face 3 times a day and then also I get acne. So, what should I do about it?
Okay, so only washing your face is not enough for clearing your acne. You should consult a doctor for therapy like oral or topical treatment. Washing alone is not sufficient to prevent the acne. It can
Sure.
clear the over sebum production above the skin, but the inside fold of the skin is still not getting cured by just
Correct.
only washing the face.
Mm-hmm. That's right, doctor. We have another question by Ahmed Khan. He asks, which cream should I use to remove the acne marks that are left?
So acne marks can be either hyperpigmentary, blackish, brownish, or it can be a post-acne erythema or red marks. So we have to do a skin examination first, then we can proceed. If it is a black or hyperpigmented brownish lesion, we can
Mhm.
go with topical kojic acid arbutin containing cream or topical retinoid cream or topical azelaic acid cream. And if it is
Okay.
inflammatory or red plate hyper, red lesion, then we can go with vascular treatments.
Okay. And why is sunscreen important for people who have acne, doctor?
Because acne people are already having a sensitive skin and their acne can get aggravated on sun exposure. If we are putting the patient on topical or oral retinoids, the sunscreen becomes a must in their daily need. Because
Okay.
oral isotretinoid or topical retinoids can induce skin dryness as well as they make the patient's skin very photosensitive. So if they are having a very high level of outdoor activity, if they are going for the work, if they are having construction workers, they are supposed to be in sunlight for a longer period of time. So
Yeah.
these patients are very prone to get side effects or adverse effects of oral isotretinoin or topical retinoids. So sunscreen becomes a must in their daily skincare needs.
True.
So
And
sunscreen can protect their skin. Huh.
yes, doctor.
So
Yeah.
sunscreen can protect their skin from
Mhm.
hyperpigmentation developing after the resolution of acne, as well as they can get tolerance to the sunlight.
True. Okay. And which type of sunscreen and moisturizer is good for an acne prone skin patient?
Okay. So considering the moisturizers, firstly, it is necessary because there will be a dryness, as I have discussed, either due to oral retinoids or topical retinoids. And the dry skin, cracked skin is more prone to bacteria deposited over that cracks. So, to first consider a ingredient to look for in a moisturizer should be a gel-based moisturizer. Avoid cream-based moisturizers or thick moisturizers and go for gel-based moisturizers and
Mhm.
non-comedogenic, non-greasy formulations. Second, considering the sunscreen, the sunscreen should have any of physical filters or chemical filters,
Okay.
which should not clog their pores, make their skin non-comedogenic as well and non-greasy as well. Like
Okay.
one should see for contents like tinosob M or tinosob S, which are highly stable form, which are present in sunscreen, and DBT, which is a new advanced sunscreen filter, which is having an anti-inflammatory action. So the lesions of acne will also get reduced by application of such sunscreens.
Mhm. Okay. And what words should we specifically check on sunscreen or the cream labels before we buy them, doctor?
First, we should, the most of the people will see the SPF like 30, 50 plus is good and ideal for use. Then we should look for PA factor of 3 and 4 is considered a good sunscreen or ideal sunscreen. Then we should
Mm.
check either it is aqueous based, gel based, cream based. So acne prone patients or acne patients should use a gel-based silicone-free or aqueous-based sunscreen rather than a cream-based sunscreen to avoid
Okay.
clogging of the pores.
Of course. Okay. And can using makeup make pimples worse, or what is a safe way to use it when we have acne?
So acne patients will mostly try to conceal their acne with high makeup, but we are recommending to use minimum makeup to avoid the clogging of pores. The brushes we are using for applying makeup should be clean and
Mm-hmm.
every second application should use a new brush or new beauty blender whatever you are using. So makeup is okay, but like in foundation we should also see for the contents of foundation or concealer, like they should be having SPF of 15 or 30 plus.
Okay. And can talcum powder be used when we have acne, and will it increase the severity of the acne, doctor?
Talcum powder is actually considered as a physical filter or physical sunscreen due to presence of talc in that, but we should look for the consistency of powder, the particle size of that powder, because the powder particles can get trapped into the pores and
True.
can aggravate the acne or develop new acne also.
Okay. And Jinal Chowdhury has a question, doctor. I have white
Yeah.
patches over my face. It may be due to dryness. So, what should I do?
So my first advice is to look for either any you are having on any retinoids like oral or topical retinoids, and then you should definitely use a moisturizer to decrease that red patch or white patch, and to protect it from getting worse, you should also apply a sunscreen on regular basis.
True. And there's another question, doctor, by Chandresh Dazatra. Its sunscreen filter requires human safety as well as aquatic safety.
Yes, sunscreen filters should have human safety also, because many of the content of sunscreen like benzones are getting popular, but they are having their own side effect profile. Like they can cause endocrine imbalance, hormonal imbalance due to higher production of androgens, and due to swimming activity or water activity, this sunscreen particles or sunscreen contents are getting deposited into the water, and they are causing a harm to the coral reefs. So we
True.
should look for coral reef safety as well as human safety.
Okay.
The newer ones, the newer sunscreen filters, which are considered safe for human as well as coral reef as well as microbiome, are Tinosoap M, Tinosoap S, which are highly stable formulations of sunscreen, and DBT. As I already discussed, it is also having an anti-inflammatory activity as well as it is water resistant. So the inflammatory lesions of acne will get relief from it, and due to water resistant, the swimming activity or sweating activity like over exercise can also be considered taken.
True. I also have a personal question, doctor. We have been
Okay.
developing acne right from our teenage years. So when we
Yeah.
see ads or serums or whatever comes online, we just tend to buy everything to just cause the severity that the acne causes. So would it be
Yeah.
better if I have some specific? Should I look at the brand name when I get a serum? Say, for example, I'm getting niacinamide. So should I look at the
Mhm.
brand that sells niacinamide, or can I just use the niacinamide serum without proper knowledge?
No, no. There are many options available considering the niacinamide serum, but first you should look for a good brand of niacinamide serum. Many companies are developing different varieties of niacinamide serum, different combination. Along with niacinamide, other contents are there also like salicylic acid, ferulic acid, vitamin C. But
Mhm.
first consideration you should give a priority to a best brand considering your skin's concern.
Okay.
And other factor should be that niacinamide is serum is only not only the option for acne treatment. You should have oral treatments also if you are getting more than 5 to 6 pimples on a daily basis.
Okay. And what if it is not an active pimple, doctor? What if we just have scars that are left from the active pimples that we had previously? So will it be
Okay.
okay if I combine one serum with a retinol cream or as such?
You can do a combination therapy, like you can use vitamin C for your pigmentation concern, or retinoids if you are having a oily skin also. Retinoids will gradually decrease the oil production also and prevent the development of new acne lesions or comedonal lesions. Vitamin C, many patients are having allergy to vitamin C, and they can cause acne from eruption also. So
Okay.
you can also go for azelaic acid serum or retinoid serum, and you can use in combination also.
Okay. But will vitamin C serum be a bit too effective for the patients who have acne prone skin, doctor? Because it just tends to react with our skin very commonly. So is it safe to use
Yes.
other than vitamin C, or vitamin C in itself is okay if we apply sunscreen on a regular basis?
No, vitamin C alone is not safe, in especially in the acne patients. Acne marks are very hard to remove, considering the depth of acne and the previous stage of acne, which left the hyperpigmented scar over there. So, those people who are having allergy or who are having an acne prone or acne skin should avoid vitamin C if possible and go for other alternatives as I have talked, like
Okay.
kojic acid serum or retinoid serum. or
Okay.
azelaic acid serum.
Okay. We have a question from Deepak Saxena, doctor. Is there any role of NER laser in acne scar treatment?
Yes, NDR laser is having a very crucial role for the post-inflammatory hyperpigmentation left behind. It can decrease the pigmentation gradually, considering the depth of pigment, either it is epidermal or dermal or a mixed pigment. And if you are having a red, flattened, hyperpigmented scar after the acne, it can also work very well on the skin. In extra, it can also decrease the pore size, decrease the sebum production, and decrease the size of sebaceous glands over time it, with each successive sessions of NDR laser. So it is having
Okay.
a very crucial role for the acne marks left behind, and also for active acne and oily skin. We can go with carbon facial treatment, which can decrease the overall oil secretion and overall inflammatory part of the acne.
Okay. And Abhishek Mishra has a question for us, doctor. Can using too many skincare products worsen your acne?
Yes, the main concern is the people are using many wrong products in wrong way, so their acne can get worsened. Always there is a golden rule that the minimum is the maximum.
Yes.
So which content you should look for into the product is always a defining factor, and also the brand which you are choosing for your skincare products is also necessary. Three basic ingredients which you should use for your daily skincare, especially Abhishek, you if you are having an acne prone skin, the minimum three things you should use regularly is an acne clearing face wash first, and then you can go for a moisturizer. The moisturizers should be applied on a damp skin or always, and always dry your skin with wet dry only. Don't rub your face, don't scrub your face. Second is always use a sunscreen, considering the side effects of retinoids will always there, causing the dryness and photosensitivity. If you are having a very high outdoor activity, you can use a sunscreen to prevent
Okay.
post acne scarring and hyperpigmentation.
hmm So when we combine multiple serums or something, doctor, will we be able to treat different kinds of issue that we have? For example, if I have acne scars and if I have
Right.
pigmentation also, so will it be okay if I use a kojic acid and a salicylic acid, or what kind of serum should be combined or should not be combined for that cause?
Serums can be combined like over a specific part. If you are having an hyperpigmentation, you can use kojic acid serum over that part. And if you are having acne, active acne, over that part to decrease the sebum production, you can use salicylic acid. You can combine, or there are many formulation available in a combination form also. In a single serum, there will be multiple active ingredients. So you can use as a single single serum having multiple contents, active ingredients in it, and you can use it accordingly.
Okay. Then how do we find if there are two or more active ingredients combined in two or three different serums, and how do we find if it will react or not, doctor?
So the good ones will have a niacinamide or salicylic acid combination, or retinoid with azelaic acid combination, or retinoid with niacinamide combinations also. The combinations which we should avoid is basically a vitamin C with retinol combination, which will decrease the effect of each other. Second is
Okay.
we cannot combine benzoyl peroxide or azelaic acid because it will also decrease each other's effect. So ideally,
Okay.
we should look for only minimum two contents in a combination serum, which are ideal for
Okay.
your skin. If you can, if you are having active acne as well as acne scarring in the form of hyperpigmentation, you can
Mhm.
go with salicylic acid, with kojic acid, or with azelaic acid. And if you are using for active acne only, you can go with salicylic acid and niacinamide serum only.
Okay. And we have a question from Gaurav Sakya, doctor. Which
Yes.
face wash would you suggest for an acne prone skin patient?
So, if you are having an acne-prone skin, you should always go for a salicylic acid containing face wash. If you are having a very oily skin and especially in the summers, you should go with salicylic acid 2% containing face wash. And if it is in winter or a dry weather, you can go with 1% of salicylic acid only. It will not cause the over dryness which can aggravate the acne.
True. That is very true, doctor. Because there are so many foaming face washes in the market these days. So if we just try to
Right.
apply the face wash and once we remove that, it feels like a layer of skin is being stripped off. So should we?
Yes.
Will it be okay if we just use a moisturizer after that, or better to avoid foaming face washes for that matter?
Foaming face washes are good considering the acne patients because the foam will always have the active ingredient in the foam formulation. Patient will not have to rub the face wash between their palms and then apply it over the face.
Yes.
Directly in the foam formulation, the active ingredient will be available and they can apply directly over their face also. They will not have to rub between the palms and do any extra other things. There will be a dryness issue after such face wash, especially considering the salicylic acid 2% or higher concentration. In such case, after face wash, always do a pet dry only. Don't rub the face in over way, and always use a good moisturizer, non-comedogenic and gel-based moisturizer within 3 minutes of face wash to prevent over dryness.
Okay. And we have a question from Pooja, doctor. Which acne causes and affects the dry skin more?
Sorry, I can't hear.
Which acne causes and affects the dry skin more?
Okay, what acne, which acne
Yeah.
is causing? Okay,
Yes.
okay, huh. So, generally there will be a myth like acne can occur only in oily skin patients, but it is not always true. Dry skin patients can also get acne. There will
True.
be a breach in the skin barrier due to dry skin. So microbiome can get easily penetrated into skin and they can enter the sebaceous glands of the skin, and there will be overproduction and proliferation of sebum and which will clog the pore eventually. So
Okay.
these patients are more prone to develop an acne over their cheeks and a lower chin area.
True. Will application of moisturizers in that case be okay, doctor, or should they stick on to a good different routine if they have a dry skin?
No, dry skin patients should always use a moisturizer, either it is a summer, monsoon, or winter season. It doesn't matter. They always should use a gel based moisturizer.
Gel based. Okay.
Hmm.
Okay, doctor. And Priyank, he has said that he has too much acne and he wants to consult you. So, will you be able to share your clinic address in that case?
Okay, so hello Priyank. I'm having my clinic in Rajkot on University Road, Glovia Skin Clinic, opposite SNK School. You can consult me here anytime between 10 a.m. to 8 p.m. for your acne concern.
Great, doctor. Thank you. And we have Harshita Solanki. She's asked, how do I apply sunscreen for my oily skin?
So, Harshita, if you are having an oily skin after your face wash and moisturizer application, if you are having an outdoor activity like before going outside on in sunlight, 15 to 20 minutes before you should apply sunscreen on all the sun exposed parts. Ideally, for the face, a three-finger rule should be used, considering the initial three fingers from tip to the base. All three fingers should be applied over the forehead, cheeks, and chin area and neck area. Don't forget the ear area also. And apply generously over the face, neck, and ears, and hands if you are having an exposed area also.
Okay.
Wait for the sunscreen to get dry and absorbed completely. Then you can go outside after that.
Okay. But related to this, I have a few doubts, doctor. What about reapplication of sunscreen in that matter? How often should we reapply? Or if we just wear
Yes.
sunscreen and then makeup, then how will I be able to reapply the sunscreen on top of the makeup, or how am I supposed to use it?
Okay, you can apply sunscreen over the top of your makeup also if you are having an outdoor activity for more than 2 to 3 hours. Ideally, sunscreen should be applied every 2 to 3 hours or after any swimming or water-related activity. Like if you are going for an exercise, then after excessive sweating, the sunscreen or the active ingredients will not work after that. So there will be need for reapplication of sunscreen. So
True.
over the makeup also you can apply the sunscreen. There is no issue. Uh, Ideally, after every 2 to 3 hours, you should get it applied.
Okay, but I've seen some brands launching a spray format of the sunscreen, doctor. Is it specifically for the acne-prone skin people, or can anyone use that?
The spray formulation is ideally for the body parts or larger areas, like if you are going for a vacation to a sunny area, or if you are having a beachside party or beachside vacay or a day out at beach. So there will be a high tendency to get tanned. Your skin will get red, tanned, and dry due to the salt content of water and due to the sun exposure. So in that
True.
case, the spray formulation will work, but only for larger body areas. But for the face and neck, you should always go for a cream-based or gel-based sunscreen.
Okay.
Spray-based will be okay for legs, forearms, arms, and other body parts.
Okay, doctor. And Jinal Chowdhury has a question for us. Oiling on scalp, does it increase acne as such?
Yes, oily scalp is the cause for forehead acne or acne over the forehead and nose, because the oily scalp will result in seborrheic dermatitis, overgrowth of the fungus, and this fungus can also produce a fungal acne, or which we call as a pityrosporum acne over the forehead and nose area or side of the nose area. So these patients are prone to get seborrheic dermatitis of the scalp as well as acne over their face. So these patients should get an acne therapy as well as the antifungal therapy for their scalp also. They should use
Oh,
a salicylic acid with ketoconazole shampoo twice to thrice in week.
okay. But will it be okay if we apply oil overhead for an acne-prone skin, doctor?
Oil application over the scalp or hair should be avoided for acne prone skin, because the some of the oil will always get diffused across the skin of the face and back. So these
Mm.
patients are more get to a back acne also. Pimples
Yeah.
over their back, their shoulders, the upper part of their chest, because some minute amount of oil will always get diffused across the skin. If either it is with sweat also, either it is with different like if they are using a pillow, the pillow will get the oil. If they are applying their face over that, they also their face can get the oil, and these patients are getting acne through like
So how
these
long is
ways.
it okay to apply in case we have an acne-prone skin, doctor? Oiling on head.
uh, Okay, oil you can apply over the ends. Don't apply oil over the scalp skin. You can apply over the ends or middle part of your hair length. And immediately you can use a good hairband to keep the hair up. So the hair should not touch over the shoulders or back, because it can
Okay.
make the skin over that part also oily. And after 4 to 6 hours, you can go with the hair wash, and you can use a good oil free conditioner also to make it dry.
Okay. So will it be okay if they use a hair serum on a regular basis because they're not applying oil on a regular basis, doctor?
Yes, hair serum can give them a smoothness also, which is necessary for always dry hair conditions, or always if they are not applying the oil, there will be some lack of moisture in their hair also. So to prevent it, You can go with use of hair serums containing hyaluronic acid or other good moisturizers, and you can use hair moistures like hair mask also.
Okay, doctor. And do we have any specific treatments for the acne scars as such?
Yes, acne scars can have a multimodality approach considering the depth of scar, the stage of scar, either it is a fresh scar or it is an old one. We can go either with fractional CO2 laser or PRP platelet rich plasma therapy over the acne scars, which will help in regeneration of collagen below the scar.
Mm,
Secondly, we can go with subcision also, and we can also go with fat grafting or fillers or biofillers therapy for acne scars, atrophic acne scars especially. If anybody is getting an hypertrophic or keloidal scar after the resolution of acne, they should be given an intralesional steroid treatment and fractional CO2 laser treatment to decrease the height of hypertrophic or keloidal scar.
okay. And you had mentioned there are three types of acne, no, doctor. One, because we get it in the forehead, that is by using oil scalp. One is in the
Yes.
cheeks, that appears during the teenage. And the one in our jawlines, it's because of a PCOS or PCOD. Can you give me some
Yes.
specific steps that people should follow in each of these three steps so we can see how people can figure it out in each stage of their lives?
Forehead acne is basically because of oily scalp. So these patients should avoid the hair oil first. Secondly, if they are having dandruff or seborrheic dermatitis, then there should be treatment of that part also as well as for their acne also. Uh, Secondly, cheeks, which is more common in pubertal age group if people are getting acne or comedonal lesions over the cheek uh, with the very first appearance of acne, they should go for a treatment to prevent the future consequences of acne. They should they should avoid high glycemic index diet, dairy products, food diet, food items which are having oily products like cheese, butter, etc. And if you
Yes.
are having acne over the chin or the lower part of face, so you should go for and if you are also having an irregular periods, you should always consult a dermatologist as well as a gynecologist if you are having a PCOS.
PCOS.
And these patients will always need combination therapy considering the hormonal therapy as well as the acne therapy from a dermatologist.
Okay. And we have a question from Aishi Patel, doctor. She says she has dry skin and she wants a good moisturizer for the dry skin patients.
Good moisturizer for a dry skin should contain hyaluronic acid, ceramides, and essential lipids. So, you should look for contents of moisturizer, and you should always go for a cream-based moisturizer.
Okay. And you had specifically mentioned about getting back acne, doctor. So there are
Yes.
specific body washes that deal with the back acne, and we have specific lotions that deal with it too.
Yes.
But is there a specific cream or is there something we could do to generally prevent the back acne as such?
To prevent the back acne, it is must to avoid, as I already discussed, to avoid an oily scalp, to avoid seborrheic dermatitis of the scalp, because during a hair combing, the tiny flakes from the scalp can get deposited over the shoulder, over the back, over the front part of your chest. So, the first one is to prevent the back acne. You should always treat first the scalp condition if you are having, and if the face acne if you are having. To prevent the
Okay.
back acne in particular, you should avoid an excessive sweating. Like the people who are used to get heavy exercise or over sweating are prone to get back acne or chest acne, because
Mhm.
overproduction of sweat can also clog the pores and it can get acne. So these
Okay.
patients after every exercise or a gym session should have a bath, and
Bath.
after the bath they should always apply a good moisturizer to the skin.
Okay. But will the severity of this back acne depend on the kind of clothes that we wear, doctor? Maybe polyester or cotton. Will it depend on that also?
Yeah. Yes, the quality of cloth, the material of the cloth will also can affect the condition, because if there will be a polyester or synthetic clothes, there will be a excessive sweating and
True.
excessive oil production over the back. And if these patients are going outdoor or having any sunlight activity, there will be over damage to the skin also. So in such cases, the material of the cloth will always matter. Always choose for a cotton and loose fitting garment, either cotton white or any thin material, rather than one which is causing excessive sweating. And
True.
always choose for a loose fitting, because the tight fitting garments will always cause excessive sweating, excessive congestion of the pores, either due to pressure effect. There will be some block in the sebum outflow also. So if you are having a tight fitting cloth, always choose for a light fitting clothes.
Okay, sure, doctor. And what do these pimple patches do to our skin, doctor? If we have active acne, we have seen people
Hmm.
using pimple patches, but from any brand for that matter. So, is there specific brands that we should stick to, or are pimple patches working as such?
Pimple patches are not that magic material which can disappear your acne in one session. So these are basically and home-based products which you can use at your home. Like after applying an active acne, you should wait for 20. Like if you are applying that acne patch after 24 to 48 hours, the acne size will get decreased, but it will not cure the basic pathophysiology behind that acne. So if you are having multiple acne, the pimple patch will not work here. If you are having an occasional one or two eruptions, then the acne patch will be okay. You should look for the contents of that acne patch. It should contain a salicylic acid, then zinc and sulfur to decrease the inflammation of acne and oil production of that acne. And
Okay.
if the acne are not getting controlled by that acne patch, then you should always consult a doctor rather than trying any home-based remedies again.
And do we recommend any home remedies as such to patients who have acne, doctor? We usually see so many remedies like using lemon and basin powder on our skin. But for acne
Yeah.
skin patients, it's really reactant to the lemon or whatever active ingredients that we are using on our skin as such. Is it true?
So the lemon in its raw form, like will be having a citric acid. So applying a raw lemon over the face can irritate the skin, can sensitize the skin, can increase the redness of the skin. So any home-based remedies I am not recommending to use for such patients, because it can can trigger the more acne development. It can uh, strip away the normal moisture layer of the upper layer skin.
True. And
So
should
such
we follow?
acidic materials to,
Yes,
sorry.
sir. No, no, no. Please go ahead.
Okay, so such raw materials like acidic material, either tomato, either lemon or basin, should not be applied on a bare skin, specifically for acne patients, because it is having some kind of acid. Basically, all the sore items, like either it is lemon, either it is amla, either it is tomato, all the sore items will have some acidic content in it, and it should not be applied on a bare skin. So I always recommend not to choose or not to go for any home-based remedies in these patients.
True. And do you have any final message or tip for our viewers, doctor? Can you also include the food diets we should include, or what haves and have-nots we have for the acne-prone skin as such on a whole, and inclusion
Okay,
of sun?
so okay, considering the do's for or haves for the acne patients, don't sorry, you should always go for a qualified dermatologist for your acne treatment. Either it is oral treatment, topical treatment, considering any therapies, any procedures for acne, like chemical peeling, PRP. Always choose a good qualified dermatologist with MD, DVT, or DNB degree. Don't go for that cosmetologist or any other. therapeutics or therapists which are going to give your skin some kind of damage using a wrong products or using a wrong concentration of an active ingredient. So always choose a good doctor for your acne concern. Always, always, always go for a food, specifically food considering the higher glycemic index should be avoided. Sugar products, dairy products should be avoided. Milk and milk products should be avoided for such patients. Go for sour fruits, sour vegetables, or vitamin A containing vegetables like mango, papaya. This will provide a natural source of vitamin A, which is necessary for an epidermal turnover to be normal for acne patients. Don't for this acne patients or patients should not go for any harsh scrubs over their face, and they should not go for any self medication or over the counter medication for their acne, because most of the over the counter medication will have steroids in that cream or gel, which will initially decrease the inflammation of acne, but it can make the remaining acne worse after stopping such treatment.
True. Thank you so much, Dr. Khyati Sidapara, for sharing such valuable insights to us today. This was a very informative and helpful session for all our viewers, and we truly appreciate your time and hope to host you again very soon. And thank you to all our wonderful
Okay.
viewers joining us today. Don't forget to follow our page, Beautiful Spotless Skin, for more expert sessions, skincare tips, and updates. Stay safe, stay glowing.
Okay.
Thank